even when COVID is behind us, we've learned a lot about the technologies that were introduced, how that could improve life even when there isn't a pandemic.
I'm JB Wogan from Mathematica, and welcome back to On the Evidence, a show that examines what we know about today's most urgent challenges and how we can make progress in addressing them. To start 2021, I invited three guests who collectively oversee all of Mathematica's work related to research, data analytics, and program improvement, and have a unique perspective not only on Mathematica's activities during a strange and remarkable year, but also of our partners' experience in the private, public, and philanthropic sectors. I asked them to reflect on themes from the past 12 months and to give us a sneak peek at some of the most exciting things that listeners can expect to hear more about in the new year. I have to confess, one of my motivations for doing this episode is that I feel some modicum of guilt about all the fascinating data visualizations and papers that we publish in a given month and don't make it on the podcast. It's just hard to get to everything. So consider this a grab bag of greatest hits and unsung heroes that were podcast worthy but haven't made an appearance yet. If you're a regular listener of the podcast, you'll recognize two of my guests from previous episodes, Chris Trenholm and Jill Constantine, who are the general managers of Mathematica's Health and Human Services units, respectively. My third guest, Adam Coyne, is new to the podcast. Adam is the Chief Administrative Officer and the Acting General Manager of the International Unit. I interviewed them separately and asked them the same three things. What's something we did in 2020 that made an impact in improving public well-being? What's something surprising or innovative that we did in 2020 that maybe flew a little under the radar? And finally, I asked them to give listeners a sense of where Mathematica and its partners are headed in 2021. I'll start with Adam Coyne in the International Unit. For listeners who might not be aware, Mathematica works in more than 50 countries across Africa, Asia, and Latin America on projects related to childhood literacy, clean energy, agricultural development, maternal and sexual reproductive health, water and sanitation services, and more. Adam currently oversees all of that work. And with that, here's my interview with Adam. So I'm talking with the three general managers at Mathematica about some of the most interesting things that have happened in their respective units, in your respective units over the past year, and also to give listeners a sneak preview of what's to come in 2021. So first, I know we're talking a lot more about impact these days, not just what the evidence says, but what happens after the research comes out. What would you say is one of the most impactful projects or published research that happened in 2020 for your unit?
In thinking about an impact we had in improving public well-being over the short term, that 2020 period, I might start by saying we jumped in to help our international clients and our partners better understand and pivot to respond to urgent and shifting needs that emerged in response to COVID-19. So really helping them address the immediacy of that pandemic and how they could adapt their programs and what they were doing. But maybe to give you a more specific programmatic example, we've also worked with local trusted partners to launch some evaluations in Africa and Asia that focus on addressing the challenges faced by smallholder farmers, which are basically small family farms, who are a critical part of the food value chain in the regions, as well as the global food system, which has been threatened by COVID-19. In one instance, Mathematica is conducting a rigorous impact and process evaluation of a dairy digitization program in India in order to generate learning and understanding about the effectiveness of digital technology in farming. In this case, dairy farming, using things like cattle activity meters, a herd management system application, automatic milk collection units, and a farmer wallet application, which offers direct payment capability and access to credit and livestock insurance for dairy farmers. So we're not only helping them be more effective in the immediate term, but we're evaluating this to understand the lessons we're learning, if and how they can be applied more broadly.
And who are we partnering with for that work?
Sure. And that work, it's actually work that we are doing through the Bill and Melinda Gates Foundation.
Okay, great. And what do you find most exciting about that project?
I think one of the things that I find most exciting about that project is the intersection of farming with technology, which really has, an opportunity and the potential to disrupt in a very effective and efficient way things that used to always be manual. So, it gives small farmers the tools that much larger farmers have to really, again, make sure that we are connecting them to the global food chain.
That's a great specific example. I mean, how much would you say COVID-19 has had ripple effects on project work in the international unit this year? Have other projects had to pivot what they're doing or how they're doing things because of the pandemic?
Sure. I actually, I would probably say no unit at Mathematica was more impacted from a work perspective because of COVID-19 than international. Well, certainly every employee at Mathematica was by, the constraints we faced in going to work. The reality is the international unit is the closest to the field across the board than any of our other units. So it ended up being really disruptive, but also inspired a lot of creativity and innovation.
Okay. So I know one of my favorite things to do on the Mathematica site is to peruse our evidence and publications page, in part because occasionally I'll see papers that I haven't heard about anywhere. They didn't get a news release. They're not on the podcast or even blogged about, but there could be some really interesting findings there. And so I thought I would ask if there's anything you think has kind of flown under the radar that could easily have been missed, even if you work at Mathematica, but is worth taking a look at now. Anything in the international unit that is sort of a hidden gem?
JB, there actually was an interesting article that may have been overlooked that we published in the American Journal of Tropical Medicine and Hygiene this year that really is about the effects of individual and combined water, sanitation, hand washing, and nutritional intervention on respiratory infections in children in Kenya. And what I like about this as a, sort of sleeper article, if you will, is I think we all got an elevated understanding on the importance of basic hygiene, including hand washing, this year with the COVID pandemic, certainly in the United States. But it highlights, an area that internationally we call WASH, that is the basic, aspects of water, sanitation, and hand washing have on our health. These are, these are sort of public health blocking and tackling, or 101, if you will. And it's easy for many of us in the United States to take these things for granted, but they are incredibly important interventions in the developing world, and understanding how to be most effective in both providing services and driving behavior change is essential.
What is something surprising or innovative that we did in 2020 in the international unit that listeners might have missed?
Sure. Maybe I'll answer these questions separately based on, sort of innovative and surprising. I actually think that the most innovative thing we did this year was figuring out ways to keep our projects and evaluation going. And we did this by figuring out ways to work remotely with stakeholders, leaning into very different and innovative data collection, using things like remote sensing, or less, sort of transformative things, switching in-person to telephone data collection. And by working with and supporting a lot of trusted local partners to actually carry out tasks on the ground. And we did this because that meant that valuable learning opportunities weren't lost, our local partners were able to continue working, and we didn't lose momentum on these critical efforts to improve public well-being. Something that I think of as surprising is the fact that the international unit is helping to lead Mathematica's role supporting Washington State's COVID contact tracing efforts. So you wouldn't necessarily think about the international unit working domestically, but it really was a nice opportunity to apply our public health skills and some of the more typical thing we would do in the developing world and our analytics capabilities to COVID here in the US, so not just globally.
Is that because we've had prior work looking at infectious disease, but outside of the U.S., and so we were able to kind of repurpose some of those staff who had prior experience on pandemics or, well, epidemics, but now in a domestic context?
Yep. So it actually, happened to be a nice combination of having a leader in the unit, Candace Miller, who had extensive interest and experience in contact tracing, and sort of that, the on the ground kind of public health, sort of expertise in really looking at disease and in this case pandemics. That was something that both applies globally, and is certainly something that's been happening for a long time in the developing world, and bringing it to the domestic context of what we're doing right now with COVID.
All right, that's a little bit about 2020. Where this episode will actually debut at the beginning of 2021. I think this past year taught us that the year can change pretty quickly, but we all make plans anyway. So in terms of planning for the next 12 months, where do you see your unit headed? What can we expect from the international unit at Mathematica, and what are some of the most exciting projects or initiatives in the pipeline?
I think more than anything, we're most excited to get back in the field. We are the group at Mathematica that's closest to our partners and the people whose lives we're working to improve. And we really felt that disconnect this year. So I certainly can say, our staff can't wait to get back in the field as soon as we can safely. I think in 2021, we're going to need to assess how the COVID pandemic has altered implementation of many of our programs. Not just slowing things down, but it may have actually changed what's being implemented or what was intended, as well as how it acts itself as sort of an extraneous variable that we'll need to consider across our work. An example of this might be in Morocco. We have a technical and vocational education and training project with the Millennium Challenge Corporation that's based on the idea that there weren't enough skilled workers in the labor force. Well, the pandemics fundamentally changed the need for workers, both eliminating the need in some areas, but potentially highlighting the need in others, like healthcare. So we are really going to have to take a fresh look at that project. In speaking to, maybe another specific project that highlights something we're really excited about outside of COVID, is an effort to improve women's economic empowerment through digital financial inclusion. And this is a project that aims to support digitization and gender-intentional design of social protection programs in order to direct payments into accounts owned and operated by women. It's known as the Digitized Direct and Design, or D3 initiative, and it's a key investment for the Bill and Melinda Gates Foundation's Women's Economic Empowerment and Financial Inclusion Strategy. And as government-to-person programs get back to work, we're going to be working with financial services for the poor partners to build out the research and learning agenda beyond just government-to-person programs in the Foundation's priority countries. The intention here is for the learnings to contribute to the global evidence, not just for the Foundation strategy, but for governments, non-governmental organizations, and others that work to improve women's economic empowerment through digital financial inclusion. So here too, it's an interesting, sort of juxtaposition and intersection between technology, equity, and research that really should be interesting and is something we're looking forward to.
Thanks to Adam Coyne for his reflections on the year we just put behind us, as well as the year ahead. Next, you're going to hear from Jill Constantine, who oversees our human services work. Human services at Mathematica encapsulates a wide range of domestic social policy, including nutrition, employment, criminal justice, child care, child welfare, child support, K-12 education, higher education, and more. Okay, here's my interview with Jill. All right, so we're talking today about the past and the future. So I was hoping from your purview at the top of the Human Services Unit, perhaps you could give me an example of something we did in 2020 that made an impact in improving public well-being. The one rule I had for the other guests is to not focus on something you've already featured on the podcast, so trying to surface something new.
Yeah, so one of my favorite studies that was many years actually in the making, and it came out late in December, and then it's ended up being timely for reasons we couldn't have anticipated so many years ago, was our work on a Pell Grant experiment that did two things. So Pell Grants are obviously very important for low-income students. And actually, for the first time in the year, Congress increased eligibility and things around Pell Grants and payments. But this was a different kind of experiment. It expanded the eligibility in Pell Grants in two ways. The first way, it allowed people who already had bachelor's degrees to get a Pell Grant to do some short occupational training. And that's different because normally you can only get a Pell Grant for undergraduate. If you have a bachelor's degree, you can't use it. So that was kind of one arm of the experiment. The other was you could, even as an undergraduate, use a Pell Grant for a relatively shorter, again, occupational training program. Typically, you need to be in like a 15-week program at least, so something that looks like a semester. This kept it to more like 8 weeks. So the goal here was to take low-income students who either already had a bachelor's or wanted to do an occupational program, not necessarily a full college program, to improve their skills and let them have some Pell Grant resources to do it. So we followed this over a number of years because enrollment started a number of years ago, and the findings were pretty dramatic. The scenario where you took people who already had a bachelor's and allowed them to use it for an occupational training course, it increased their enrollment and completion by 20 percentage points. And for the group that allowed them to use it for shorter training programs, it increased participation, enrollment, and completion by 10 percentage points. And this is really important. Again, at the time, we couldn't have imagined our current environment of people being out of jobs and the importance of occupational training and the number of people who were thrown into poverty or lost their jobs or things like that. So it was just at the time, if we were more expansive on who was eligible for Pell Grants, would that be useful? But moving forward, it's real important because getting people the training they need if they've been displaced is going to be all the more important. So that's kind of my favorite, many years in the making, flying under the radar a little bit, but really important findings came out just at the end of the year that I think are very valuable for the field of education and training.
All right, so that is one project that came to fruition in 2020 that we wanted to highlight. I also wanted to ask, maybe not necessarily in terms of something impactful, but something surprising or innovative that we did in 2020, and particularly something that maybe listeners could have missed, something that flew a little under the radar.
Right. So I'd say our main innovations were largely around the disruption to every agency trying to provide services to clients. So WIOA agencies, the one-stop workforce innovation boards, TANF agencies, obviously school districts and school food authorities. So we went from the kind of studies where we study clients coming in and getting training, or we study meals kids are eating or what kids are doing in the classroom, to how are we going to figure all that out remotely. So many of our innovations were around figuring out how to do that remotely. So within education, I'd say our main body of work are lots of things around pulling together information around the two things that were of most interest. Remote learning in general, although there's not a lot of evidence on it, it's certainly not how this remote learning looks, but more how to keep students engaged and then applying that to a remote setting. So we both kind of pulled together information, and then we started a number of efforts and projects with some state and local state agencies and school districts around helping them understanding what their schools and districts are doing. And then in our WIOA and TANF spaces, we did a lot of work to both understand how to keep clients engaged, getting their services if you're only offering them virtually. And then particularly with our TANF agencies, working to bring staff and providers together and doing trainings all virtually, doing the communities of practice around how to deliver services all virtually, and then keeping basically a library of videos around that. So we now have more than 100 videos of different community participants that provide TANF services around how to do that, how to stay engaged, and that's just a resource now that other TANF agencies can use. So we're also did some work for the Food and Nutrition Service within Department of Agriculture, again, to understand what school food authorities in cooperation with the school districts did to get food to students who were no longer going in the classroom to get it. So most of our innovations were around how to get these services, critical services, to students, to families, to displaced workers, all trying to figure it out remotely. And some of that is out in information that came out at the end of 2020, but some of it will be coming out in 2021.
So, all right, we're recording this actually just in the first few days of 2021. So, we've done kind of a year in review. But the last question I'd like to ask is more of a preview question. What are some of the most exciting projects or initiatives in the pipeline for this year?
Yep. So I'd say there are two tracks of things, again, both which really were highlighted in 2020. So the first track is the amount of acknowledgement and therefore interest in social and racial injustice in the country. So with foundations leading the way, we've seen a lot of interest among foundations in framing their strategies, their efforts around equity and improving equity. So we've just started to work with the Gates Foundation around looking at taking an equity lens to all of their portfolios, which they're building in their portfolios, but making sure it's coherent and that they have real markers of what it would mean to be infusing equity in that work. We are just, there was a time back in September, the previous administration wasn't allowing any sort of racial equity or training or anything that suggested there was any systemic racism in the country. If that is lifted with the new administration, then more federal agencies will be free to frame their efforts, their investments around addressing, again, social, economic, and racial inequity and injustices. We are already starting to hear from federal agencies that that's of interest. So I think that's everything around what not only the protests and the Black Lives Matters around highlighting disparate police actions, but also COVID, right? Showing the sort of social, economic, and health inequities that occur in our countries were just highlighted in 2020. So we're really poised to infuse that in all of our work moving forward. So I think that is one line of work that we're very excited about because Mathematica wants to be on the forefront. We in Human Services want to be on the forefront of improving racial and social and economic equity in this country. And then the other line is all of the takeaways, even when COVID is behind us, we've learned a lot about what the technologies that were introduced, how that could improve life even when there isn't a pandemic. So, for example, we'll start to see some work out of a study that was really about teacher professional development, about can you improve teacher performance if you just do a lot of observation and feedback, a lot more than you typically see in schools. But the way that was facilitated was actually through video taping, and then Skype video coaching sessions. So obviously in the pandemic, that got super important. Like that's the only way you could do it. But moving forward, that allows a lot of flexibility that you don't have to have somebody physically in the classroom all the time providing coaching and feedback. So we'll have some findings on that this year, but we're seeing school districts, but TANF agencies, WIOA agencies say, okay, well, what have we learned here about how you can use technology, remote technology, to provide better services everywhere? Some work we're doing with some state agencies and school districts. There's already some interest. What we saw this year were teachers dropping in on each other's classes to get some tips on how to keep students engaged, but you didn't have to drop in on somebody in your own school. You could be somebody across the district or somebody across the county, right? That really opened up the ability to learn from each other without having to physically be in the same space. So I think that's the other. Again, we're not anticipating remote learning forever. We're not anticipating remote delivery of services forever, but we're learning a lot about, well, is any of that useful for keeping students engaged, clients engaged, people trying to obtain workforce training or skills? So I'm really excited for that. I don't think that's going to leave us, the good things that technology brought us, and that's going to be infused in a number of our projects moving forward also.
Yeah, the first part about equity, racial, social, and economic inequity, it seems to be connected with some of the work that we've done in the past. And I was thinking specifically of something we featured in the podcast before with regards to school suspensions and how school disciplinary policies do or do not affect, students of color disproportionately. Which I remember there was a study in Philadelphia, and then there was also work that you all did
In Maryland.
in Maryland, yeah.
Yeah, and what's interesting is that was important. That was kind of the only lens that people were seeing things through because there was such data to support the disproportionality. But I think what we're going to see moving forward are two things. The fact that COVID so disproportionately impacted communities of color, lower income communities, and the fact that students were then disproportionately impacted by not having good internet access, not having necessarily the time and the space to stay engaged. I think, again, on two fronts, people will need to address whatever learning loss and inequities were caused there. And for example, the incoming administration has proposed tripling Title I funding. Well, Title I is for low income schools. So it's not proposing, oh, let's just increase funding. It's like, let's target it where we think there was the most disproportional impact. So I think you may see a broader lens. And then the other, everything around how do you keep students engaged. Again, I think that's broader to how do you keep anyone engaged who's trying to learn skills and develop skills. So I think there'll be a harder look at inequities in those practices and policies too, and more efforts around how do you improve that. So I think that's going to be one of our most exciting areas. It's just been watching the acknowledgement and the demand for it among our clients, stakeholders, things like that has been nice, right? It's just a broad acknowledgement. It just really, 2020 just highlighted racial and social inequities in this country. So I think we're going to see more interest in more really Mathematica, and human services are very excited to be leaders in that moving forward.
Thanks to Jill Constantine for her reflections and forecasting there. Our final interview for this episode is with Chris Trenholm, who oversees the health unit at Mathematica. Given that an infectious disease has become such a central part of all of our lives in the past year, the health team here has been quite busy. In an earlier episode in June, Chris appeared on the show to reflect on the pandemic as well as the racial disparities in healthcare and health outcomes that the pandemic has exposed. Besides helping with managing the response to COVID-19, our health team works with public and private sector partners on improving programs such as Medicare and Medicaid and employing health information technology to address the quality, efficiency, delivery, affordability, equity, and financing of healthcare. So Chris and I get into some of what his team has been up to over the past year, both COVID-related and not. So give me an example of something we did in the health unit that made an impact in improving public well-being.
We've had a chance to do work in ways that we haven't traditionally, very close to some of the issues that states are struggling with, doing work in contact tracing for Washington State, running their tracing efforts. We completed a really important study for the state of Connecticut on the experience that took place under COVID in the long-term care facilities and reported to the governor on steps that could hopefully be taken in Connecticut to prevent those events from happening again. We're supporting municipalities on use of wastewater to monitor COVID. We're about to launch a survey on public willingness and concerns about the vaccine for a health system around here in New Jersey. So that's been really important work and feels very close to the public. Having said that, I'm actually going to answer the question by backing up to something that we do quite a bit, which is working for CMS, Center for Medicare and Medicaid Services. And I want to mention something we've done for a long time, which is a project to run a learning system on behalf of accountable care organizations. So these are they're called ACOs, and ACOs were formed under the Affordable Care Act. And the idea was to bring different healthcare organizations, provider groups together to kind of capture the experience of the entire patient. So to share and coordinate the healthcare of an individual patient rather than it being broken up in different ways. And so these ACOs formed under the Affordable Care Act, and there are now several hundred of them for the Medicare program. And we started a project way back in 2013, 8 years ago, called Learning Systems for Accountable Care Organizations. And our mandate from CMS was to work directly with the ACOs to help them foster a learning environment where they could understand where success was happening, obtain best practices, and really continually improve the practice of being a successful accountable care organization. So that the reason I mentioned this project is because it ended this year after 8 years. The ACOs are kind of launched now. We do other kinds of learning system work for CMS, but the ACOs support around 12 million, the Medicare ACOs are around 12 million Medicare patients, so they are incredibly important to the healthcare of millions of Americans. And I'm really proud of the work that we did with CMS and with the ACOs over those 8 years. We really got to know the experience of managing an ACO up from the leadership of those organizations right down to the experience of patients working with providers, with doctors and nurses. And one of the really gratifying things this year was with COVID, there were a lot of changes adopted around what ACOs could do. And one example of that was in telehealth, where they permitted accountable care organizations to, for the first time, regardless of where they were situated, they could apply telehealth medicine and be reimbursed. So you could have a virtual office visit with an elderly patient, and regardless of the circumstances, that could be supported. And that's complicated. Many of the organizations have little experience doing that. There's a little bit of navigating the new policy and understanding that. And we really jumped on that and worked closely with the ACOs to see that they could support and implement telehealth as successfully as possible during the pandemic. And that felt very important. I think our work was important to those ACOs having success in delivering patient care early in the pandemic and to this day.
I don't know if so. The other question I was going to ask about this past year was whether there was something surprising or innovative we did that maybe flew under the radar and listeners might have missed. I don't know if that is, if you've already previewed your answer to that question by mentioning telehealth, or if you have something else in mind for this question.
There were a couple of really exciting challenges put out of the federal government relating to data analytics, visualization, data science. And we thought, hey, we're pretty good at that stuff. And we really understand this intersection between policy and data and technology. So let's have a go at those and see what we can do. And the first was work for AHRQ, Agency for Healthcare Research and Quality, where they were asking for organizations to submit to a challenge to produce a visualization of data that would really reflect the best practice of successful data visualization, both from the experience of a user in being kind of applying principles of human-centered design, but also being something that really benefited decision makers or the public in understanding something about our healthcare or healthcare system. And what we did is we put together data from several sources. Our friends at the Robert Wood Johnson Foundation, Center for Disease Control, CMS, state health departments, national surveys, to produce a visualization tool, an app. You can actually go find this app. If you look at our data visualization challenge, you'll find us there. It's an app that we developed that you can go in and enter any county in the United States or look up any county in the United States, and it will produce for you information around their social determinants of health and how they are performing in critical social determinants compared with other counties. And so it was really nice. It pulled together a lot of disparate data in a way that allowed a user to gain a good understanding of, hey, how is my county doing around critical determinants of the healthcare of my population? So anyway, so we submitted that and we won. We won the data visualization challenge. And the second one is actually an even larger stage, where CMS put out a challenge around artificial intelligence, where they wanted organizations to advance the use of AI on behalf of the Medicare and Medicaid programs. And I think there were over 300 entrants to the CMS AI challenge, and we made it to the first phase of cuts down to 25 organizations. And we were pretty proud looking at ourselves and the organizations listed that we were at the forefront of AI work on behalf of CMS. And we just found out not too long ago that we actually made the finals. So we are one of just 7 organizations in the world that is leading on AI at CMS in the challenge. And so now we are working our tails off to try to win. The winner gets $1 million, which would be neat, and also gets to be recognized for really being at the lead of contributions to CMS. It's a neat tool. What we're doing is trying to pursue artificial intelligence tools that can help at the primary care level, help them in the healthcare setting be more effective. But in addition, also see that those tools are applying principles of algorithmic fairness, which is a growing field in AI where the concern is being recognized that just because it's artificial intelligence doesn't mean that it's not at the same risks of racial or other forms of bias in the healthcare setting. So we're introducing into the AI that we're developing for CMS, or in this challenge, principles of algorithmic fairness.
One theme from this year is I can think of at least 3 examples of competitions related to digital technology and analysis that resulted in something very productive for us. Those 2 challenges you've mentioned, but also the internal civic hackathon that resulted in the 19andMe app. Do you think that there are going to be more competitions, either internal or external, going forward that will help drive innovation at Mathematica? I mean, is that a precursor of what you expect more of in the coming decade?
I do, JB. We had fun with that. I'll say we took a weekend or 2 back in March and April, and our data scientists referred to it as Hackamatica. And out of that, was produced this 19andMe tool that allows individuals to get a risk score around their risk of COVID. And it's been used, to my knowledge, hundreds of thousands of times now, if not even more than that. So it's found an audience. And similar to the challenges, like you said, we really just did that because we thought we could contribute and really came up with the ideas as our own, trying to figure out where we could be helpful. And I do think that's a trend. We respond to requests from organizations and individuals about a question or a challenge that they have, and we respond to those and work to the best of our ability to advance decision makers' ability to make good decisions, create evidence, all the things Mathematica does and is known for. But we're also now seeing, hey, there are things that we're seeing and really want to lead on and kind of get out in front maybe of questions that others have and try to really be at that vanguard. And so the Hackamatica work, the challenges, it's all in service of that. And I really want to acknowledge the leadership of the data science community at Mathematica. We have an incredibly skilled, mission-driven, passionate group of computer science, methodological, brilliant experts. But boy, they're really focused on the work moving from the lab into practice and really helping policymakers and decision makers and the public be better equipped in terms of improving public well-being. And that's really been an important development for us the last 10 years. We've always had good capability in statistics and econometrics and methods, but really building a bench of data science and then marrying that data science capability with policy expertise and subject matter expertise, it's really been a rich experience. And I think, to your question, I think we're only getting started, JB. I'm really excited about the 2020s.
So that may be these competitions and the greater use of data science may be one trend we see more of in 2021, but can you look into your crystal ball and give us some sense of what else you think might be on the horizon for the next year in health at Mathematica?
It may be in the spirit of how I opened up. I'm actually going to move back from some of the digital frontiers and some of the advances in our own organization in the field around AI and tech and so forth, and actually just move back to really fundamental programs and fundamental work that Mathematica does. I mentioned at the outset the work to stand up the Affordable Care Act, the accountable care organizations within the Affordable Care Act on the Medicare side. We also are really privileged to be partners with the Medicaid program federally, and we also work with states and other actors who are very invested in Medicaid, places again like Robert Johnson Foundation, other philanthropic groups, a range of actors who care deeply about the Medicaid program and making sure that it's successful in helping lives. And there's an enormously important trend underway in the Medicaid program that's really going to take root in the next 10 years. And it's really the next generation of the move of the American healthcare system from one of volume-based care to value-based care, to paying and seeing that the system is incentivizing for the contribution of healthcare, not just for the mere service of it. And this is something that has been underway the last 10 years on the Medicare side. And it's in many respects easier to implement on the Medicare side because the Medicare program is federally managed. All the data sit with a single actor in the federal government. And the program is in a sense monolithic. And so the ability to really implement something as complex as value-based care it's far from straightforward, but the learning could really emerge over the 2010s. Medicaid is a very challenging program because it's actually managed at the state level. It's 50 state Medicaid programs, and you've got the other territories, the District of Columbia. So you've got all of these different actors, and then the program serves very different populations: children, frail, elderly, low-income Americans. So it's got a range of groups that it serves. And the data and the systems and the measures necessary then to build out a value-based care system in Medicaid is really a lot of work, even to just get on the starting gate. So we've had the pleasure the last several years of helping CMS and states kind of get to the starting gate and move out of the starting gate of Medicaid managed care. And you've started to see some really, really important payment reform emerge. And one to just illustrate that we're closely involved with that's really important and just illustrates again this move towards value in Medicaid and towards really delivering a focus on quality is in maternal opioid misuse. It's a model called MOM, maternal opioid misuse model. And it's really about trying to, again, to capture that whole patient experience of a mother or pregnant woman who has opioid dependency or experiencing opioid misuse. And it's trying to really see that there's a wraparound whole system of support that is interconnected and then incentivized through proper payment to ensure that that mother is supported or the maternal experience is supported to every extent possible. So we have a contract that we started last year to monitor the successful implementation of that MOM model and try to help CMS continually improve it. And that's really been a pleasure to work on and feels enormously gratifying. That's one of many examples I can think of where we're kind of engaged in the work of moving the Medicaid program to one focused on value in the way that the MOM model focused on value. I'll just illustrate one other example, a little bit different, quite different flavor. We know a lot about Medicaid data and about the challenges in the quality of those data for a range of reasons. Those data are not up to the quality in many cases needed to implement a well-measured, well-monitored, well-implemented, value-driven Medicaid program that can really achieve all of its ideals. And so we've actually are developing a product that we call Immersis. We see an opportunity to take our expertise and house them in something that's a tool that can then be put out for others to use. And this first tool called Immersis is allowing states to take their data that they report to CMS on fundamentals of the Medicaid program and help themselves to see that those data are as high quality as possible. So it's kind of a brave new world for us in working with a product, but we think it's something that really we only know how to do that piece well, and we want to do it for states as efficiently and make it as easy as possible. So that's one of, I'm imagining, JB, over the next several years, we'll probably have quite a few of these kinds of tools and products that we'll be making available to support states and others on Medicaid managed care, value-based care as they move into this new space.
I want to thank all three of my guests for coming on the show: Adam Coyne, Jill Constantine, and Chris Trenholm. We'll post this podcast on the Mathematica blog, along with lots of links to the research and tools that Adam, Jill, and Chris referenced in our interviews. If you're a fan of this podcast, please share it widely. We want to make sure we're reaching everyone who cares as much about objective, data-driven policy as we do. You can also help us by giving us a rating and review. We're on Apple Podcasts, Spotify, Stitcher, Google Podcasts, pretty much everywhere you find podcasts. We'll keep covering interesting work from Mathematica and our partners on this show, but another way you can stay up to date on everything Mathematica is doing is following us on Twitter. I'm at JB Wogan. Mathematica is at Mathematica Now.